Welcome to another deep dive. And today we're focusing on something uh, pretty incredible, something that can really make a difference in your nursing practice, and that's body language. We've got some really great experts in this field, and we've got a lot of info from them, like Barbara and Alan Pease, Joe Navarro, all about decoding those nonverbal cues, those little things that, honestly, they can make all the difference when you're working with patients.
It's fascinating, isn't it, how much we're actually communicating without even realizing it? Like, you think about it, and for nurses especially, you guys are always observing and assessing. I mean, this is a real superpower.
Oh, absolutely. And you know what I think it's even more amazing is that, did you know the in-depth study of body language, like really digging into the science of it? It's actually pretty recent. Like it wasn't until the 1960s that people really started to delve into it.
That's right. I mean, we've been communicating non-verbally forever, right? Like since, I don't know, the dawn of time, millennia. But it's only in the last, what, 60, 70 years that we've really begun to understand those nuances
Yeah.
and the insights. I mean, they're pretty amazing. Just one example, okay? Research actually suggests that only about 7%, just 7% of our communication is actually coming from the words we speak.
Wow. Just 7%. That's incredible. So what about the other 93%? Where's that coming from?
Well, a chunk of it, about 38%, that's our tone of voice, right? How we say things. But the biggest chunk, are you ready for this? A full 55% is nonverbal body language.
That's incredible. It really highlights just how much we're relying on those unspoken cues, to really understand each other, especially in nursing, right? You're dealing with patients who might be in pain, they're anxious, maybe they can't even fully articulate their needs.
Precisely. That's exactly it. Think about it. You know those gut feelings you get as a nurse? You know those moments where you just sense something's not quite right, even if the patient is saying, oh, yeah, I'm fine. That's your ability to read body language. You're picking up on those little inconsistencies between what they're saying and what their body's doing.
So it's like being a perceptive nurse, it's all about understanding that nonverbal language. It's a whole language on its own.
Absolutely, spot on. And the good news is some signals are universal. A smile, generally, that means happiness, right? A frown that suggests sadness or anger. Nodding means yes. Shaking your head, no. Those are pretty consistent across cultures.
That's reassuring. So even when you're dealing with patients from all different backgrounds, you've got those basic signals. It's like a starting point.
Exactly. But here's where things get even more interesting. Think about this. The concept of congruence. That's about whether a person's words are actually matching their body language. Let's say a patient says, okay, I understand the treatment plan, but their arms are crossed, tight, and their brow is furrowed. That incongruent, that mismatch, that's a clue.
It's a sign, right? Like a red flag that there might be something more there, some hesitation, some uncertainty.
Exactly. And here's a little tidbit. Studies actually show that women are generally better at decoding body language than men. So you might need to be even more mindful, those nonverbal cues, especially with your female patients. They're more likely to pick up on those subtle inconsistencies.
That's a good point, something to remember. Okay, let's get into some specifics now. What about hand gestures? I mean, those can be so expressive. What should nurses be aware of in that area?
Well, even something as simple as a handshake. A handshake can reveal a lot. Think about the power dynamic, right? Palm up, that can be seen as submissive. Palm down, a little more dominant.
Oh, interesting. So I guess if you're a nurse with a dominant handshake, probably not the best approach when you're trying to, build rapport and put a patient at ease.
Exactly. You want to project confidence, but you don't want to come across as overbearing. Aim for neutral, palms vertical. That shows respect, and it helps the patient feel more comfortable.
Makes sense. Now, what about those double-handed handshakes? You know the ones. Do those ever have a place in healthcare?
That's a tricky one. We call that the double hander. And while it can convey sincerity, it can also feel a bit too familiar, especially when you're meeting a patient for the first time.
So probably best to err on the side of caution with that one. Okay. Are there any handshakes that nurses should absolutely avoid?
Oh, definitely. The stiff arm thrust, where you rigidly extend your arm, it's like saying stay back. And then there's the socket wrencher, where you grip way too hard and twist the other person's hand downward. That's a dominance move, and it can actually be painful.
Ouch. Yeah, definitely not the vibe we want to be putting out there. Okay, are there any other hand gestures that are particularly revealing, especially in a healthcare setting?
Absolutely. Let's talk about the palms in pockets stance.
Oh, yeah, that's a common one. I see patients do that all the time when they seem a little uncomfortable or hesitant about something.
You're right. It can signal reluctance, anxiety, maybe even disengagement. It's a cue, a little sign to dig a bit deeper and see if there are any unspoken concerns or anxieties the patient might be having.
So those hands, They really do speak volumes.
They do. And you know what else is a powerful communicator? The face. It's a window into a person's emotions. And for nurses, one of the most important expressions to really understand, to decode, is the smile.
Of course. I mean, smiles are so important for building that rapport and making patients feel at ease, right? But are all smiles created equal?
That's a great question. There's a big difference between a genuine smile, a real smile, and a fake one. A real smile, a genuine smile, it engages all the muscles around the eyes. It creates those little crow's feet wrinkles.
So those wrinkles are actually a good thing.
They are. If you see those wrinkles, that's a pretty reliable indicator that the smile is genuine. If they're not there, well, that smile might be hiding something. Fear, anxiety, discomfort, you name it.
So those wrinkles, they're like a little secret code, right? A clue for nurses trying to figure out how a patient's really feeling.
Absolutely. And while we're on the topic of facial expressions, let's talk about laughter. Laughter is a powerful tool, but it's not always just about humor, you know.
Oh, that's interesting. What else can it mean? What else is laughter telling us?
Well, it can be a way of bonding, especially for women, but it can also be a way of asserting dominance, particularly for men.
So while a little lightheartedness can definitely help put patients at ease, nurses need to be aware of the context, right? Read the room, so to speak.
Exactly. Now, let's move on to another expressive part of the body, the arms. How someone positions their arms, that can tell you a lot about how they're feeling.
All right, arm signals. Let's dive in. What should nurses be looking out for?
Well, let's start with the classic crossed arms. It's a pretty common defensive pose, often indicating disagreement, maybe anxiety, feeling closed off. And it's not just about fully crossed arms either. Holding a handbag, clutching a wrist, even just keeping those hands tucked in the pockets, those can all create a similar kind of barrier.
So even those subtle variations, they're still sending a message, right? Like, hey, I'm not totally comfortable here.
Exactly. And if you see those cross arms along with clenched fists, well, that's a sign of like heightened anxiety, frustration. It could mean the patient's really struggling to cope and might need some extra support.
That's a good one to watch out for. Now, what about the opposite? Are there any arm positions that, I don't know, project more confidence? Authority, maybe?
You know, it's interesting. People in positions of authority, they often keep their arms unfolded, showing openness, a lack of fear.
So if a nurse wants to project confidence, appear approachable, maybe keep those arms relaxed and open, especially with patients who might be feeling a little, I don't know, vulnerable or anxious.
Absolutely. It sends a message of, I'm here to help, I'm not a threat.
This is fascinating. It's amazing how much we can learn just by looking at someone's arms. Now, I'm curious about those truth tellers, the legs and feet. What kind of secrets can those reveal?
Oh, the legs and feet. Those are notorious for giving away what people are really thinking and feeling, even when they're trying to mask it with their face or their upper body. It's like a subconscious commentary.
So what should nurses pay attention to when it comes to legs and feet? Give us the inside scoop.
Okay, well, first, foot direction. If a patient's foot is pointing toward the door, that might suggest a desire to leave, or maybe just feeling a little uncomfortable with the conversation.
Interesting, like their body is already subconsciously preparing to make a quick exit.
Exactly. And then there's leg crossing, a sudden leg cross, right in the middle of a conversation. That can signal a shift in comfort or agreement.
So it's not just about whether the legs are crossed, but about any changes in that position.
Precisely. It's those little shifts that can be really revealing. And keep an eye out for ankle locking. That's a classic freeze response, often means anxiety, fear, discomfort. You might see it in patients who are, say, apprehensive about procedures or just feeling overwhelmed.
So ankle locking, that's a sign to maybe pause, offer some reassurance, make sure the patient's feeling safe and heard before you move on.
Exactly. It's all about being attuned to those nonverbal cues and responding in a way that, puts the patient's well-being first.
This is so insightful. I feel like I'm already becoming more aware of these subtle signals. Is there anything nurses can do, proactively with their own body language to build better connections with patients?
There is, and one powerful technique is mirroring, which we touched on briefly earlier. It's about subtly matching a person's posture, their gestures, even their tone of voice, to build rapport and understanding.
So if a patient is sitting with their arms crossed and you want to help them feel more open and relaxed, you might, I don't know, subtly uncross your own arms. Just kind of mirror that.
Exactly. But the key word here is subtle. If you're too obvious about it, it can backfire. It can feel like mimicking, and that can make people uncomfortable.
So it's about finding that sweet spot where you're reflecting their body language, but not being too, in their face about it.
Precisely. It's a delicate dance. But when it's done well, mirroring can be really effective. It builds trust, and it helps the patient feel heard and understood.
That makes sense. Are there any other maybe spatial considerations that nurses should be aware of? Like how close they stand to a patient or things like that?
Absolutely. Everybody has their own invisible bubble, right? We call it personal space. And those bubbles, they can vary in size depending on culture, personal preferences, things like that.
So a nurse who stands too close to a patient, they might unintentionally make them uncomfortable, maybe even threatened, even if they have the best intentions.
Exactly. It's really important to be aware of that physical proximity, especially during procedures or sensitive conversations. Watch for those little cues, things like leaning back or angling their body away. Those are signs that you might need to give them a little more space.
It's all about respect, right? Respecting those nonverbal boundaries.
Precisely. And it's not just about the physical distance, but also your own body language, your tone of voice. Those matter too. A calm, reassuring presence that can work wonders. It can really help put a patient at ease.
So we've talked about mirroring, matching a patient's body language. But are there any techniques that involve, I don't know, maybe intentionally mismatching body language?
There are, and one that can be really helpful, especially for nurses, it's called spatial anchoring. It's a technique, and it's used to help people kind of shift their emotional state by actually physically moving them to a different spot.
Oh, that's interesting. So let's say a patient's feeling really agitated, overwhelmed, maybe in their hospital room. Could a nurse suggest, I don't know, a walk down the hall, just a change of scenery? Would that help?
That's a great example. Yeah, by physically moving the patient to a different environment, you're basically anchoring them. You're connecting them to a different emotional state. It's almost like hitting the reset button, for their nervous system.
That's fascinating. It's like using the environment itself as a tool to influence mood. Okay, so we've got mirroring, we've got spatial anchoring. Are there any other, I don't know, spatial considerations that nurses should be thinking about?
Definitely. Personal space, proxemics, as it's sometimes called, it's crucial. Everybody's got that invisible bubble around them, right? And respecting those boundaries, especially in a healthcare setting, that's so important. People are feeling vulnerable.
So even just standing too close to a patient could make them feel uncomfortable, even if you don't mean to.
Absolutely. You've got to be really aware of your proximity, how close you are, especially during procedures or when you're having, I don't know, a sensitive conversation. And watch for cues. If they lean back or angle their body away, that's a pretty good sign that you might need to give them a little more breathing room.
It's about sensitivity, right? Respecting those nonverbal boundaries. It's like an unspoken language.
Exactly. And it's not just physical distance, your own body language with tone of voice, all of that plays a huge role. Being calm, reassuring, that can make a world of difference, can really put a patient at ease.
Speaking of calming presences, I'm kind of curious about the role of touch in nursing. Obviously, it's a very sensitive topic, but I can imagine that a gentle touch, done appropriately, could be incredibly comforting to a patient.
You're right, it is sensitive, and consent is absolutely paramount always. But you're right, when it's done appropriately with permission, a gentle touch on the arm, maybe the shoulder, it can convey empathy and support in a way that words sometimes just can't.
It's a powerful way to connect, just on a human level. Are there, I don't know, cultural differences that nurses should be aware of when it comes to touch? Is it okay in some cultures and not in others?
Oh, absolutely. Touch is very culturally bound. In some cultures, it's very common, very accepted. In others, it's much more reserved. So nurses need to be sensitive to those differences and adjust their approach.
So if you're working with a patient from a culture where touch is maybe not as common, probably best to err on the side of caution and, I don't know, maybe rely on other nonverbal cues to show that you care.
Exactly. Observe their reactions. Adjust your approach based on their comfort level. It's all about being responsive.
So we've talked about mirroring, spatial anchoring, the power of touch, and the importance of cultural sensitivity. Any other, I don't know, overall tips for nurses who are really looking to, really enhance those nonverbal communication skills? What else can they do?
Self-awareness is huge. Pay attention to your own body language, how it might be coming across to others. If you're stressed, anxious, those feelings, they can leak out, even if you're trying to seem calm and collected.
So a nurse who's having a rough day, they might unintentionally be sending those stress vibes to their patients, even if they're saying all the right things.
It happens all the time. We're always sending nonverbal signals, whether we realize it or not. So check in with yourself. Be mindful of your posture, your facial expressions, your overall energy.
It's about making sure that I don't know, that your actions are matching your words.
Exactly. And remember, patients are often picking up on those subtle cues, especially when they're feeling vulnerable or anxious.
Self-awareness, that's a great point. Any other words of wisdom? What else should our listeners know?
Practice, 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 practice. The more you observe body language, both in yourself and in others, The more intuitive it becomes, you'll start to pick up on those little cues, those tells, those things that reveal what's really going on beneath the surface.
It's like learning a new language, right? The more you immerse yourself in it, the more fluent you become.
Exactly. And just like learning a new language can open up a whole world of communication and connection, so can mastering the language of the body. It can help you connect with your patients on a much deeper level, understand their needs more fully, and ultimately just provide more compassionate care.
Now, I'm curious about those really quick, fleeting expressions that we sometimes see, those micro expressions that just flash across someone's face for a split second. Are those something that nurses should be paying attention to? Are they important?
They can be very telling. Microexpressions, they're involuntary. And they often reveal, hidden emotions, thoughts. It's like a little peek into the subconscious.
So even if a patient's trying to keep a neutral face, those micro expressions, they might give away their true feelings?
They can, but they're tricky. They're so quick, you can easily miss them if you're not really paying close attention.
Sounds like it takes a really keen eye and a lot of practice to even notice them, let alone interpret them accurately.
It does, and that's why it's important for nurses to remember, don't rely solely on microexpressions. They're just one piece of the puzzle. You always have to consider them along with other nonverbal cues and the overall context. What else is going on?
It's like any form of communication. Got to look at the whole picture, not just one little piece. Are there any specific micro expressions that are, I don't know, maybe particularly relevant for nurses to watch out for?
One that comes to mind is disgust. Disgust is a natural reaction to things that we find repulsive, contaminated. But in a healthcare setting, it could be triggered by, bodily fluids or the sight of a wound, something like that.
So if a nurse sees that little flash of disgust on a patient's face, it might be a cue to offer reassurance or anticipate their needs, even if they haven't said anything, even if they haven't verbally expressed any discomfort.
Exactly. It's about recognizing that the patient might be experiencing something they're not quite ready to talk about and just responding with sensitivity, with care.
That's so insightful. Are there any other micro expressions that are really telling, especially in a healthcare setting? Any others we should know about?
Fear. Fear is another one to keep an eye out for. It can be very fleeting, but it often means that a patient is feeling anxious, threatened, maybe unsafe.
So if a nurse sees that micro expression of fear, even for a split second, they might need to adjust their approach, right? Make the patient feel more secure or more comfortable.
Exactly. Again, it's all about being attuned to those subtle cues, those little hints, and responding in a way that supports the patient's well-being. That's always the goal.
It's incredible, isn't it? How much we can learn from these tiny little expressions, these flickers of emotion. I mean, most people probably don't even notice them.
They are fascinating, aren't they? They remind us that there's always so much going on beneath the surface, even when people are trying to, keep it together, maintain a calm exterior.
Now, aside from micro expressions, are there any other nonverbal cues, maybe a little less subtle, that nurses should be aware of? Anything else they should be looking for?
Absolutely. One that's often overlooked is appearance, how people dress, how they present themselves.
Clothing. Really? I wouldn't have thought that would be particularly revealing.
Oh, you'd be surprised. Clothing, it can be a powerful form of nonverbal communication. It can tell you about a person's personality, their cultural background, even their emotional state in the moment.
So a nurse who's really observant, they might be able to gain some insights for a patient's clothing, and that could help them, I don't know, personalize their care a little bit.
Exactly. For example, let's say you have a patient who's dressed in really loose, comfortable clothing. That might be signaling a need for, relaxation, privacy, whereas someone who's dressed meticulously, every detail in place, they might be looking for more control, attention to detail.
Wow, that's fascinating. It's like their clothes are a reflection of what's going on inside.
They can be. And don't forget about other aspects of appearance. Hygiene, posture, even the way they carry themselves. All of those things can be indicators of their overall well-being, their emotional state.
So a patient who's kind of slumped over, avoiding eye contact, maybe neglecting their hygiene a little bit, that might signal, I don't know, depression, maybe low energy. While someone who stands tall, makes eye contact, really well groomed, they might be projecting more confidence, more vitality.
You got it. It's all about observing those cues, big and small, and using those observations to inform your interactions and really provide patient-centered care.
It really is amazing, how much information we're getting away constantly without even realizing it. But I guess to really get good at this, it takes practice, observation.
Exactly. The more you pay attention to those little cues, the more those cues will just jump out at you. It becomes second nature. Like anything, the more you do it, the better you get.
So true. Okay, before we wrap up, any final pearls of wisdom for our nurse listeners out there? Any advice for putting all this knowledge into practice? What can they do?
I'd say don't just observe body language, experiment with it. Use it consciously. in your interactions with patients.
Experiment. How do you mean?
Try out some of the techniques we've talked about. Mirroring, spatial anchoring, the power of touch. See what happens. Pay attention to how it impacts, not just your patients, but you too.
So be curious, be willing to try new things, see what works, right? It's different for every situation, every patient.
Exactly. And the more you practice, the more natural it'll become. You won't even have to think about it. And you'll be amazed at the connections you can make, the insights you'll gain when you start really speaking, the language of the body.
This has been an incredible conversation. Honestly, I feel like I've learned so much, like a whole new level of awareness about how powerful nonverbal communication really is. Thanks for, taking us on this deep dive.
My pleasure. And remember, the body never lies. It's always communicating, always giving us clues, inviting us to connect, on a deeper level. We just have to learn how to listen.
Beautifully said. And to all our listeners out there, keep observing, keep learning, keep using this incredible skill. It can really elevate your practice and help you make those really meaningful connections with your patients. Until next time.